A mental health nurse is responsible for the assessment and evaluation of the patient's mental health, development of treatment care plan, consultation with other health professionals about treatment plan, provision of care and psychotherapy treatment, maintenance of medical records, supports and education to the patient and their family. Nurse educators are valuable members of healthcare community. They have extensive and comprehensive knowledge of how the healthcare system functions. They also understand the need of patient and are aware of theories of teaching and learning. Nurse educators begin their careers as registered nurses. After receiving an advanced nursing degree, these individuals choose to teach new nurses valuable skills by becoming nurse educators. Some of the most common responsibilities of a nurse educator include teaching clinical skills and patient care, instructing hospital research, guiding students through clinical rotations, designing and evaluating program curriculum. A nurse manager is an individual in a medical setting with the decision making power to influence daily operations. They can advocate for improved patient care by optimizing certain processes that a hospital or healthcare organization fulfill every day. The exact responsibilities of a nurse manager can include creating department schedules that identify when nurses and other staff members will work, supervising nursing staff members as they serve patient, address patient conflict, communication with family members, and perform all other necessary aspects of their positions, providing patient care through all of processes required by comprehensive bedside nursing. As a nursing manager, you will make decisions that positively influence how hospitals and clinic organizations perform daily. Nurse midwives practice in hospitals and private practice medical clinics and may also deliver babies in birthing centers and attend at-home births. Nurse midwives provide care of women across the lifespan, including during pregnancy and the postpartum period, and well women care and birth control. Duties and responsibilities of a nurse midwife provide professional reproductive and gynecological health care, works independently or collaboratively with other medical practitioners, promote the concept of minimal intervention. A nurse practitioner is a nurse who has advanced clinical education and training. Nurse practitioners share many of the same duties as doctors. They perform physical exams, diagnose and treat disease and other health conditions, and prescribe medication. A nurse practitioner must have a graduate level degree of education. They work in a variety of healthcare settings, including physician office, clinics, hospitals, emergency rooms, urgent care site, nursing home, colleges. They may work independently or with doctors to provide a full range of healthcare services. Take and record medical histories and symptoms, perform physical examination, order diagnostic tests such as laboratory tests, x-rays, analyzed test result, diagnose and treat illnesses, disease and other health conditions. Nurse administrators supervise nurses and other healthcare team members. They recruit, hire and train nurses. Other responsibilities include building work schedules and conducting performance reviews. Nurse administrators are responsible for maintaining the budget and reporting on financial matters, serving as a liaison between nurses and other hospital workers, including executive, establishing policies and procedures and ensuring staff is in compliance, developing a strategic vision for the hospital and department. Nurse administrators, sometimes called nurse managers, nurse directors, or chief nursing officers, do not get direct involved with patient care. However, their job duties most assuredly affect patients' experiences and outcomes. Administrators keep their staff motivated, oversee or provide needed training, and ensure that regulations are met, if not exceeded. Oncology nurses are registered nurses who take care of either cancer patients or those with the potential of developing cancer. Oncology nurses work with physicians and other medical professionals to prevent, diagnose, treat, and manage cancer symptoms as well as provide palliative care. Oncology nurses' responsibilities might include monitoring a cancer patient's condition, running various tests and evaluations, managing symptoms in cancer patient, administering medication to cancer patient, helping to manage the side effect of treatments such as chemotherapy, administering chemotherapy and other treatments like infusions. An orthopedic nurse spends time encouraging patients to increase their mobility, educates about how to protect their joint and bone health, and implements strategies to minimize their pain and complications. Orthopedic nurse work in hospital units, offices, and outpatient care clinics. They work with a wide age range of patients and care for both men and women. Orthopedic nurse is a specialty that focuses on musculoskeletal diseases and disorders. These orthopedic issues include conditions like arthritis, bone fractures, broken bones, joint replacement, genetic malformations, arthritis, and osteoporosis. Pediatric nursing is a specialization of nursing profession that focuses on pediatrics and the medical care of children from infancy to the teenage years. This is an important field because the health of children is distinct from that of adults due to the growth and development that occurs throughout childhood. Pediatric nurses usually work in a multidisciplinary team with other health professionals to provide the best medical care possible for children. Individuals well suited to career as a pediatric nurses is likely to have the following traits: cheerful and friendly, good communication skill with people of all ages, organized and able to follow complex treatment plans, works well under pressure. A public health nurse is a registered nurse who advocates for positive changes in population health. This exciting career gives nurses the opportunity to work directly within communities to educate people and give them the tools they need to improve their health outcomes. Where do public health nurses work? Government organizations, non-profit organizations, school systems, community clinics, outpatient clinics. The responsibilities of public health nurses include recording and analyzing aggregate medical data, evaluating the health of patient and creating treatment plan, monitoring patient for any changes in condition, delivering top quality care alongside physicians, educating patients about available support services and helping them access care. Travel nursing is a nursing assignment concept that developed in response to the nursing shortage in the United States in 1970s. This industry supplies nurses who travel to work in temporary nursing positions mostly in hospitals. Travel nurses can also work abroad. Common jobs for travel nurses include hospitals, clinics, community health center, private practices, rehabilitation facilities, nursing homes. Some personal characteristics that serve travel nurses on the job include ability to learn quickly, resilience to persevere in challenging contexts, flexibility, comfort with working in new environments, a strong support network. A neonatal nurse is a nurse that works specifically with newborn babies, typically in their first month of life. Most often, neonatal nurses work with infants who face specific challenges right after birth, including birth defect, heart problems, prematurity, and more. Neonatal nursing is one of these subspecialties that allows nurses to be qualified to work with newborn babies and their mothers. Neonatal nurses focus their work on caring for newborns and sometimes focus on premature babies who are in the neonatal intensive care unit. The main work of neonatal nurses is to help mothers during birth and after the birth of their child. They perform traditional nurses' duties like checking vital signs and monitoring patients, performing tests on newborn babies, performing neonatal tests throughout a woman's pregnancy, and helping patients decide on an effective care plan for patients. Thank you for watching our video. Check the I button above for new release of next part. Subscribing our channel, stay tuned.